Siobhan Bailey.
Thank you, Madam Chairman, and I congratulate the Honourable Member for Waverley for bringing this debate. I did enjoy the spirited contribution from the member for Bootle, particularly the political attacks, which are characteristic, but it highlights to me part of the problem that we're actually dealing with here, because if we are unable to recognise failures across a number of different governments, across a number of different decades, we will never get to solutions. And equally, if we continue along the lines of the NHS, or anything about the NHS being this constant political football, we will paralyse this country and things will not get done. Now, I know the Labour Party like to blame everything on the government, but I actually think today's debate has been really useful to hear all the different elements of the things that are going wrong for the NHS dentistry, including the part that the NHS itself can play with handling, HR, looking after staff and retention. So I do think that's important. But this is a crucial health issue for my constituents in Stroud. Like other members, we have a number of different points of casework, and we have emails about this all of the time. Anybody that's had toothache knows it's debilitating. You can't get on with your day. You start off grumpy, you end up not speaking, and my husband liked that bit. And then anybody that's seen a child with decaying teeth, they start to worry about what's going on at home. They start to worry about the health and the future of that child, and they're right to do so, because the minute the teeth are gone, it's very, very difficult to repair them. I'd like to thank all the Stroud dentists. I, like others, had so many people, dentists, contact me, offer help during COVID. They were some of the first to be frustrated about some of the restrictions placed on them, but also the first to be offering help. Now, in Gloucestershire, the CCG has seen a drop of 17 NHS dentists between 2019 and 20 to 2020-21. It's a drop of 5% in 1 year, so similar to colleagues, it's a very worrying development. This is also, we believe, likely to underrepresent the real fall in capacity, because most dentists tend to reduce their NHS contracts before leaving the service, and only 33% of adults in Gloucestershire saw an NHS dentist in the 2 years to June 2021. To give some colour and some real-life experience, one of my constituents moved to Stroud in January 2020. She fell pregnant and she was entitled to free dental care, but by the time she had her MAP B1 certificate, she was unable to find a dentist. She could not find a dentist throughout the pregnancy time when she would have had that free dental care. She couldn't find a dentist and hasn't still. I mean, she spoke to 15 dentists in the local area, Stroud, Wootton, Stonehouse and Gloucester, all of which told her they were not accepting new NHS patients. I think an interesting and worrying point that she raised with me is that all of the dentist surgeries she spoke to who are accepting children as NHS patients, so her little one is about 1 now, they're only doing so if the parents join them on a private basis. So she and her husband have found themselves having to join on a private basis and pay the fees to make sure that her little one has that NHS cover. And again, so many parents would not have that option, but I don't think that should be her only option to get support for her child. The 3 key areas I'd like the Minister to cover, and no doubt that she will. Obviously, Norfolk desperately wants a training centre, just in case you hadn't got that point. But I think this one. So number 1, what is the explanation for the delays in creating the improved new contracts for the NHS dentists? I mean, we're spending £3 billion. Why are we still in a situation where the actual terms of a contract, a piece of paper, is preventing people getting into this profession, a worthy and very skilled and amazing profession as it is? On the recruitment issues, what is the plan? We've heard that almost 1,000 dentists quit the NHS last year. We've heard about the issues surrounding people sort of going back to European countries, and we've heard that people are not coming from abroad further afield. Can existing resources be used to improve the recruitment and the retention? I know the Minister responded to me very clearly we've got similar problems with the midwifery services. We've got lots of recruitment in retention issues in the NHS. So as the similarities, what can we do? How is the government using the post-pandemic period to really reimagine the NHS dentistry in both areas of the preventative action? So for families from birth, we're hoping to bring in family hubs around the country. Can they be used to improve children and families' awareness of healthcare and dental health, and then also to the responsive package? The data collection points really worry me. We are never going to improve services if our CCPs around the country do not have the information, and we've heard that from a number of colleagues. Finally, I just want to say, you know, I do want everybody to think about that toothache and the pain, because it is absolutely awful to go through. Our constituents are really worried about this. I think that we can make changes. I don't think it's just a money issue, and I hope that we can really have a concerted effort, given that there's so much cross-party support to make change. Thank you.